All right, welcome back. Let's jump straight into our rapid-fire revision of the UPSC CMS previous year questions. We are going to be tackling questions 20 all the way through 40. Let's get started. Okay, question 20. A 30-year-old man met with an accident and presented with multiple fractures of ribs and paradoxical movement with severe respiratory distress. X-rays shows pulmonary contusion on right side without pneumothorax or hemothorax. Which one of the following is the initial choice of treatment? Is it A, B, C, or D? The correct answer is B, endotracheal intubation and mechanical ventilation. Look, this is a classic flail chest scenario with respiratory distress. The key here is that positive pressure ventilation acts like an internal splint, It stabilizes that chest wall from the inside. The absolute first priority is to secure that airway and support their breathing right away. Question 21 asks, which of the following is not a clinical feature of tetanus? Your options are rhesus sardonicus, opisthotonus, loss of consciousness, or respiratory failure. The correct answer is C, loss of consciousness. And this is a really important point to remember. The tetanus toxin does all this terrible damage to the nervous system, causing spasms, but it actually doesn't cross the blood-brain barrier. That means the patient, terrifyingly, remains fully conscious throughout. Next up, question 22. Hyperchloremic acidosis is a common complication of what? Ureterosigmoidostomy, diarrhea, vomiting, or ileostomy? Well, the answer here is A, ureterosigmoidostomy. So why does this happen? When you divert urine into the colon, the lining of the colon starts to reabsorb chloride from the urine. To maintain balance, it has to secrete bicarbonate in exchange. What's the result? You end up with too much chloride and not enough bicarbonate in the blood, leading to that very specific acidosis. Question 23 gets into a little bit of physics. Endoluminal probe for transrectal ultrasonography operates at the frequency of which of these? 2.5, 5.0, 7.5, or 15.0 megahertz? The correct answer is C, 7.5 megahertz. It's all about this trade-off. A higher frequency gives you much better resolution, which is exactly what you need for getting a detailed look at a superficial structure like the prostate. The downside is that high-frequency waves don't penetrate very deep, but for this specific job, it is the perfect tool. Question 24 is about a piece of equipment you'll definitely see. A Seldinger needle is used for what? A liver biopsy, breast biopsy, lymphangiography, or arteriography? The answer is D, arteriography. But really, it's used for so much more. The Seldinger technique is the absolute foundation for getting percutaneous access to blood vessels. It's a complete game changer in medicine. On to question 25. The ideal temperature to store the whole blood in blood bank is what? -4, 0, 4, or 8 degrees Celsius. The answer, the sweet spot, is C, 4 degrees Celsius. It's a really delicate balance. You need it cold enough to slow down the metabolism of the red cells and to prevent any bacteria from growing. But if you go too cold, you risk freezing and destroying the cells. So 4 degrees is just right. Question 26 asks about a specific treatment. Biscard treatment refers to that of a ruptured Achilles, a venous ulcer, an ischemic ulcer, or an ingrowing toenail. This refers to B, venous ulcer. The Biscard regimen is a conservative management plan. It involves things like massage, special exercises, and of course compression therapy to help improve venous return and allow those ulcers to heal. All right, question 27, a classic. Glasgow Coma Scale GCS score ranges between which of these? The correct answer is D, 3 and 15. Now, this is a super common trip-up. So many people think the lowest score is 0, but it's not. Remember, the GCS has 3 parts: eye-opening, verbal response, and motor response. For each of those, the lowest possible score you can give is 1, even if there's no response at all. So you add them up, 1 plus 1 plus 1 gives you that minimum of 3. Moving on to question 28. The most common cause of intestinal obstruction is obstructed hernia, inflammatory conditions, malignancy, or bands and adhesions. While all of them can cause it, the #1 culprit in the developed world is D, bands and adhesions. This is especially true after someone has had abdominal surgery. The body can form these internal scar tissue bands that can kink off the bowel. Question 29 asks, the most common site for nosocomial, hospital-acquired infection is the respiratory tract, urinary tract, surgical site, or bloodstream. The answer here is B, the urinary tract. And honestly, the vast majority of these are catheter-associated UTIs, or CAUTIs. That catheter provides a direct pathway for bacteria to get into a sterile environment, which is why proper care is just so critical. Okay, a clinical scenario for question 30. A patient has carcinoid tumor of appendix of size more than 2.5 centimeters. The management of choice is which of these? Appendectomy alone or with further tests, or right hemicolectomy? The correct answer is D, right hemicolectomy. With appendiceal carcinoid tumors, size is everything. Once they get bigger than 2 centimeters, the risk of them spreading to nearby lymph nodes is just too high. So a simple appendectomy isn't enough. You've got to do a right hemicolectomy to get clear margins. Question 31 asks, what is the most common cause of intestinal obstruction in neonates? Is it meconium ileus, duodenal atresia, volvulus, or Hirschsprung's disease? The most common cause is B, duodenal atresia. Intestinal atresias in general are the most frequent cause. And duodenal atresia is that classic double bubble sign you see on an X-ray. It's a very common type. Question 32 is one of those classic matching questions about chemo side effects. We have our list of drugs and a list of complications. So which code is correct? The answer is D. Let's lock these in. Cisplatin causes tubular necrosis, adriamycin is linked to cardiomyopathy, bleomycin is known for causing pulmonary fibrosis, and cyclophosphamide can cause hemorrhagic cystitis. These are absolutely high-yield associations you just have to memorize.
Question 33 gives us 4 statements about hemophilia A and B. We need to select the correct ones. The right answer is A, which means statements 2 and 3 are correct. Let's break it down. Statement 2 is perfect. Hemophilia A is a factor 8 deficiency, and B is a factor 9 deficiency. Statement 3 is also true. They're both X-linked recessive traits passed on by female carriers. The other 2 are wrong because they are distinct diseases, not variants, and they almost exclusively affect males.
Question 34 is a critical care scenario. A 30-year-old lady sustained chest injury in an accident and presented with massive hemothorax on right side. Tube thoracostomy drained 1,800 milliliters of blood. What is the most appropriate treatment? A, B, C, or D? The only correct answer is D, resuscitation and prepare for urgent thoracotomy. An initial drainage of over 1,500 milliliters of blood is the definition of a massive hemothorax. This bleeding is not going to stop on its own. You have to resuscitate and get that patient to the operating room immediately to find and control the source. In question 35, we're looking for all the signs that suggest a hernia has become strangulated. So we have 5 options to consider. The correct answer is D, which means all 5 of them are suggestive. Every single one of these points to a compromised blood supply, which is the definition of strangulation. Shock, constant pain, rebound tenderness, a tense and irreducible mass, these are all major red flags for a surgical emergency. Question 36 asks us to find the one correct statement about hemorrhagic shock. Is it A, B, C, or D? The correct statement is C. A loss of 40% of circulating volume is life-threatening. This is class 4 shock, and it's incredibly dangerous. The other options are incorrect. Clinical signs usually appear after about 15% blood loss, not 10%. Tachycardia is common but not present 100% of the time, especially in patients on beta blockers. And in the acute stage, the body's response is massive vasoconstriction, not vasodilation. Question 37 is about poor prognostic indicators in advanced germ cell tumors. We have 3 statements. Which ones are correct? The answer is A. 1, 2, and 3 are all correct. This comes straight from the standard IGCCG classification. A primary tumor in the mediastinum, having non-pulmonary metastases, so think liver or brain, and having a really high LDH are all classic features of the poor prognosis group. Question 38 tests our anatomy knowledge of a classical radical neck dissection. Which one of the following structures is not removed? The options are trapezius, sternocleidomastoid, internal jugular vein, or the accessory nerve. The answer is A, the trapezius. The classic dissection removes the SCM, the IJV, and the spinal accessory nerve. Now, an important detail is that by sacrificing the accessory nerve, you do paralyze the trapezius, but the muscle itself is not physically removed. Question 39 asks about a specific piece of equipment, the mucobarbin tube. What is it used for? Advanced cancer of the stomach, esophagus, oropharynx, or all of these? The correct answer is B, advanced cancer of the esophagus. This is a bit of a historical question. It was one of the early types of palliative stents used to bypass an inoperable tumor and allow a patient to eat. And our final question for this session, number 40. Which one of the following is the investigation of choice in a patient with hematemesis? Is it endoscopy, a barium meal, a CT scan, or angiography? The answer is, without a doubt, A, flexible upper gastrointestinal endoscopy. Why? Because it's both diagnostic and therapeutic. You can go in, see exactly where the bleeding is coming from, and often treat it right then and there with clips or injections. It is absolutely the gold standard.